Since early on, I had an interest in medicine. Part of it grew up in Thailand where the access was somewhat difficult. And I became a rheumatologist because of the people. I like the people and I like the challenge that it can often present in this field. When you consider a lot of other specialties has much more straightforward diagnosis, rheumatology is quite different. At times, you will see challenging cases because one diagnosis can affect many organs and sometimes simultaneously. So when you have a patient with a complex cases and you try to resolve the issue, walking them through their sickness, their illness, trying to put science, labs, history, physical, and then come up with an elusive diagnosis, I think is challenging. And after nursing school, I thought, this is what I want to do. So I entered medical school and decided to be a rheumatologist. Good listener. You got to be a good listener and you have to pay attention to details. A lot of times when I get a patient, they would say like, you are my last hope. What I normally hear from my patient, I'm glad you listened to me. And we share a lot of what we call decision making with our patients. And because of the time that I can get to spend with my patient, so many of them we have a good long-term relationship. We have a big osteoporosis practice currently, followed by osteoarthritis, rheumatoid arthritis, and lupus and vasculitis. The differences is osteoarthritis, we call it a wear and tear. You will feel pain, you will have some deficit in day-to-day basis, versus osteoporosis is a measurement of bone density to see how fragile your bone is, how thin your bone is, and you don't feel pain, but potentially you could prone to fracture if you don't treat the condition. We have been doing quite a fair amount of viscose supplementation injection on the knees.